Phlebotomy Certification Exam Needle Stick Safety Quiz. Question 1. If a phlebotomist sustains a needle stick during a skills check, which action should happen first in the emergency department bay during a skills check? Option A. Finish all remaining patients before reporting. Option B. Recap the needle to identify its size. Option C. Wash the area immediately and follow the facility exposure reporting procedure. Option D. Ignore it if the patient looks healthy. The correct answer is option C. Wash the area immediately and follow the facility exposure reporting procedure. Immediate cleansing and prompt reporting support timely exposure evaluation and follow-up. Delaying the report can delay medical assessment and documentation. Recapping increases sharps injury risk and is not needed to report the exposure. Appearance does not determine whether a blood-borne pathogen risk exists. Question 2. Why should contaminated needles generally not be recapped after venipuncture in the physician office lab during a practice drill? Option A. It causes all specimens to hemolyze. Option B. It changes the additive in the tube. Option C. It makes the tourniquet too tight. Option D. Recapping creates a preventable sharps injury risk. The correct answer is option D. Recapping creates a preventable sharps injury risk. Recapping requires bringing the hand back toward the contaminated sharp, which increases needle stick risk. Hemolysis is affected by collection and handling factors, not by recapping alone. Tube additives are not changed by whether a needle is recapped. Tourniquet tightness is unrelated to needle recapping. Question 3. After reviewing the order, which action reduces sharps injury risk immediately after withdrawing the needle in the community health screening event during a scenario? Option A. Activate the safety feature as designed and dispose of the device promptly. Option B. Carry the exposed needle to the lab. Option C. Set the exposed needle on the bed. Option D. Hand the exposed needle to a coworker. The correct answer is option A. Activate the safety feature as designed and dispose of the device promptly. Safety activation and prompt disposal isolate the sharp before it injures someone. Carrying an exposed needle increases injury risk during transport. A bed is not a safe surface for a contaminated sharp. Passing an exposed needle puts the coworker at risk. Question 4. If a hematoma starts to develop during venipuncture, which action is appropriate in the preoperative testing area during a competency review? Option A. Continue filling all ordered tubes. Option B. Release the tourniquet, remove the needle, and apply pressure. Option C. Massage the swollen area vigorously. Option D. Ask the patient to bend the elbow tightly. The correct answer is option B. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Continuing the draw can enlarge the hematoma. Vigorous massage can worsen bruising and tissue injury. Bending the elbow can increase bruising and does not provide focused pressure. Question 5. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the Oncology Infusion Center during a final review? Option A. Ask the patient to stand up and walk it off. Option B. Leave the needle in while getting more tubes. Option C. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option D. Give the patient food before removing the needle. The correct answer is option C. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Standing can lead to a fall. Leaving the needle in place while symptoms progress increases injury risk. Food is not the first action while a needle is still in the arm. Question 6. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the dialysis-adjacent clinic during a study session? Option A. Skip pressure to avoid bruising. Option B. Ask the patient to bend the elbow sharply. Option C. Use the same bandage time for every patient without checking. Option D. Apply firm pressure longer and verify bleeding has stopped before bandaging. The correct answer is option D. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Skipping pressure increases bleeding risk. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Question 7. During a structured exam prep drill, which action helps prevent a hematoma after removing the needle in the student skills lab during a structured exam prep drill? Option A. Apply clean gauze with firm pressure while the arm remains straight. Option B. Have the patient bend the elbow tightly. Option C. Rub the puncture site to spread the blood. Option D. Remove the needle before releasing the tourniquet every time. The correct answer is option A. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Bending the elbow may increase leakage into tissue. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Question 8. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the occupational health clinic during a clinical simulation? Option A. Proper venous flow. Option B. Possible arterial puncture. Option C. Tube additive carryover. Option D. Normal capillary refill. The correct answer is option B. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Typical venous flow is darker and not pulsatile. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Question 9. For a thyroid panel collection, which tube is collected first when blood cultures are ordered with other venipuncture tubes? Option A. Lavender EDTA tube. Option B. Gray fluoride tube. Option C. Blood culture bottles or sterile culture tube. Option D. Serum separator tube. The correct answer is option C. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. EDTA tubes are collected later to prevent additive carryover. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. Question 10. In the standard venipuncture order of draw, which tube usually follows blood cultures in the outpatient clinic during a mock exam? Option A. Lavender EDTA tube. Option B. Gray fluoride tube. Option C. Royal blue tube for every test. Option D. Light blue sodium citrate tube. The correct answer is option D. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. EDTA is collected later because it can interfere with coagulation and chemistry tests. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. Question 11. After reviewing the order, which order is most appropriate for collecting blood cultures? Light blue, serum, green, lavender, and gray tubes in the hospital unit during morning rounds during a skills check? Option A. Blood cultures, light blue, serum, green, lavender, gray. Option B. Lavender, gray, green, serum, light blue, blood cultures. Option C. Gray, lavender, green, serum, light blue, blood cultures. Option D. Serum, lavender, blood cultures, gray, light blue, green. The correct answer is option A. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with lavender risks EDTA contamination of later tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Question 12. Why does order of draw matter during evacuated tube collection in the urgent care laboratory during a practice drill? Option A. It makes patient identification optional. Option B. It helps prevent additive carryover from altering later specimens. Option C. It eliminates the need to mix tubes. Option D. It determines the patient's fasting status. The correct answer is option B. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Patient identification is required regardless of tube order. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Question 13. During capillary puncture, which specimen type is generally collected first when ordered in the pediatric clinic during a scenario? Option A, serum specimen. Option B, gray top microtube. Option C, blood gas specimen. Option D, non-additive tube after all others. The correct answer is option C. Blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Serum is not first when blood gases are ordered. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Question 14. Before proceeding with the draw, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the long-term care unit during a competency review? Option A, serum microtube before EDTA for every draw. Option B, gray microtube first even when blood gases are needed. Option C. Any order because capillary tubes have no additives. Option D, EDTA microtube before other additive and serum microtubes. The correct answer is option D. EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Serum first collection can allow clotting before the EDTA specimen is filled. Blood gases are more time-sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Question 15. During a final review, which tube is most appropriate for a routine CBC in the mobile collection site during a final review? Option A, lavender top tube containing EDTA. Option B, light blue sodium citrate tube. Option C, gray sodium fluoride tube. Option D, red no additive tube. The correct answer is option A. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Citrate is used mainly for coagulation testing. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Question 16. In the emergency department bay, which additive is found in a light blue tube used for patient and APTT testing? Option A, EDTA. Option B, sodium citrate. Option C, sodium fluoride with potassium oxalate. Option D, lithium heparin. The correct answer is option B. Sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. EDTA is used mainly for hematology and can interfere with coagulation testing. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. Question 17. For a patient/INR collection, which tube is commonly selected for many serum chemistry tests when gel separation is desired? Option A, lavender EDTA tube. Option B, light blue citrate tube. Option C, serum separator tube with clot activator and gel. Option D, gray fluoride tube only. The correct answer is option C. Serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. EDTA plasma is not serum and can interfere with some chemistry tests. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. Question 18. To protect patient safety, which tube is commonly associated with heparinized plasma chemistry testing in the community health screening event during a clinical simulation? Option A, lavender top tube. Option B, light blue top tube. Option C, pink top tube. Option D, green top tube. The correct answer is option D. Green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Lavender tubes contain EDTA for hematology. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Question 19. After reviewing the order, which tube is most commonly used for glucose preservation when testing may be delayed in the preoperative testing area during a review? Option A, gray top tube with sodium fluoride and an anticoagulant. Option B, plain red tube only. Option C, light blue citrate tube. Option D, blood culture bottle. The correct answer is option A. Gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. A plain red tube does not contain glycolysis inhibitor. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. Question 20. When preparing for collection, which tube is commonly used for blood bank testing such as type and screen in the Oncology Infusion Center during a mock exam? Option A, gray top fluoride tube. Option B, pink top EDTA tube. Option C, light blue citrate tube. Option D, green heparin tube for every blood bank test. The correct answer is option B. Pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Gray tubes are associated with glucose or lactate preservation. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Question 21. In a routine phlebotomy scenario, which tube is generally collected for a blood culture specimen in the dialysis adjacent clinic during a skills check? Option A, lavender EDTA tube only. Option B, gray fluoride tube. Option C, sterile blood culture bottle or SBS containing culture tube according to policy. Option D, SST after clotting. The correct answer is option C. Sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A lavender tube is not designed as the primary blood culture container. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. Question 22. Why must a light blue citrate tube be filled to the proper level in the student skills lab during a practice drill? Option A. The tube color changes if underfilled. Option B, EDTA needs extra room to mix. Option C, serum cannot clot unless the tube is full. Option D. The blood to anticoagulant ratio must be correct for coagulation results. The correct answer is option D. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate-to-blood ratio, commonly described as 1 part citrate to 9 parts blood. Tube color does not change to warn of underfilling. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Question 23. After collecting an additive tube, how should it usually be mixed in the occupational health clinic during a scenario? Option A. Gently invert the tube the recommended number of times. Option B. Shake it hard until bubbles appear. Option C. Leave it unmixed until centrifugation. Option D. Open the stopper and stir with a wooden applicator. The correct answer is option A. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Vigorous shaking can cause hemolysis. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Question 24. In the blood collection station, which problem can occur if a lavender EDTA tube is not mixed soon after filling? Option A. The tube becomes sterile for culture. Option B. Microclots may form and make hematology results unreliable. Option C. The specimen turns into serum. Option D. The sodium citrate ratio improves. The correct answer is option B. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. Mixing does not create sterility for culture testing. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Question 25. For a hemoglobin A1C collection, which practice helps reduce hemolysis during a routine hemoglobin A1C collection? Option A. Force blood rapidly through a small needle. Option B. Shake additive tubes vigorously. Option C. Use appropriate needle size and gently invert tubes instead of shaking them. Option D. Pull back a syringe plunger as hard as possible. The correct answer is option C. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Forcing blood through a small needle can damage cells. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Question 26. To protect patient safety, which laboratory result is especially affected by hemolysis because red cells release intracellular contents in the hospital unit during morning rounds during a study session? Option A. Patient date of birth becomes invalid. Option B. Tube expiration date is extended. Option C. Tourniquet pressure becomes lower. Option D. Potassium may be falsely increased. The correct answer is option D. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. Patient demographics are not changed by cell rupture. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Question 27. When using a syringe for blood transfer, which method best protects specimen quality in the urgent care laboratory during a structured exam prep drill? Option A. Use a safety transfer device and allow blood to flow gently into tubes. Option B. Remove the tube stopper and push blood in forcefully. Option C. Squirt blood through the needle into each tube. Option D. Shake each tube hard to remove clots. The correct answer is option A. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Removing stoppers increases exposure and contamination risk. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Question 28. Why should alcohol be allowed to dry before puncture in the pediatric clinic during a clinical simulation? Option A, dry alcohol makes the tube additive stronger. Option B, wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option C, wet alcohol improves vein anchoring. Option D, alcohol drying replaces tourniquet use. The correct answer is option B. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Drying does not change the chemical strength of tube additives. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Question 29. In a routine phlebotomy scenario, which specimen often requires protection from light after collection in the long-term care unit during a review? Option A, CBC specimen for platelet count. Option B, routine sodium citrate coagulation tube. Option C, bilirubin specimen. Option D, blood culture bottle during incubation. The correct answer is option C. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. Question 30. Before proceeding with the draw, which specimen commonly requires rapid transport on ice or chilled handling according to policy in the mobile collection site during a mock exam? Option A, routine CBC kept for the next day. Option B, serum separator tube for a lipid panel after clotting only. Option C, blood culture bottle placed in the freezer. Option D, ammonia specimen. The correct answer is option D. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A routine CBC should not simply be held for the next day without stability guidance. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. Question 31. During a skills check, which action best maintains specimen integrity during transport to the laboratory in the emergency department bay during a skills check? Option A, follow required time, temperature, light, and handling instructions for the ordered test. Option B, store every specimen at room temperature overnight. Option C, centrifuge every tube immediately regardless of type. Option D, place all blood specimens in direct sunlight. The correct answer is option A. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Overnight room temperature storage can make many specimens unacceptable. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Question 32. If a specimen must be transported cold, which approach is appropriate in the physician office lab during a practice drill? Option A, submerge the tube in loose ice water. Option B, place the specimen in the approved cooling method without direct water contamination. Option C, hold it in a bare hand to keep it visible. Option D, place it near a heater until pickup. The correct answer is option B. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Loose ice water can damage labels and create contamination issues. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Question 33. For a basic metabolic panel collection, which situation is a common reason for specimen rejection? Option A, collector wore gloves. Option B, patient stated date of birth. Option C, wrong tube type or insufficient specimen volume. Option D, tube was labeled at the bedside. The correct answer is option C. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Wearing gloves is expected when blood exposure is possible. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Question 34. Why should tube expiration dates be checked before collection in the preoperative testing area during a competency review? Option A. Expired tubes identify patients faster. Option B. Expired tubes prevent hemolysis in every case. Option C. Expired tubes are required for coagulation testing. Option D. Expired tubes may have inadequate vacuum or unreliable additive performance. The correct answer is option D. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. Expiration dates do not help verify identity. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Question 35. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the Oncology Infusion Center during a final review? Option A. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Option B. Draw the specimen and write fasting on the label. Option C. Tell the patient not to mention the meal. Option D. Cancel every test without notifying anyone. The correct answer is option A. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Marking the specimen as fasting would be inaccurate documentation. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Question 36. Why is fasting status important before some chemistry tests in the dialysis-adjacent clinic during a study session? Option A. Food changes the patient's legal name. Option B. Food intake can alter analytes such as glucose or lipids. Option C. Fasting makes needles sterile. Option D. Fasting eliminates the need for tube mixing. The correct answer is option B. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Food intake does not affect patient identity. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Question 37. For a medication trough level, when is the specimen usually collected in the student skills lab during a structured exam prep drill? Option A. Immediately after the medication is swallowed. Option B. At any random time during the day. Option C. Immediately before the next scheduled dose. Option D. Only after the medication is discontinued for a week. The correct answer is option C. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Immediately after dosing reflects absorption or peak timing, not trough. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Question 38. During a glucose tolerance test, why must collection times be followed carefully in the occupational health clinic during a clinical simulation? Option A. Any time is acceptable if the tubes are gray. Option B. Timing only matters after the last tube. Option C. The patient should eat between timed draws to stay comfortable. Option D. Timed results show how the body responds to a measured glucose dose. The correct answer is option D. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Tube type does not remove the need for precise timing. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Question 39. During a review, which documentation is especially important for a timed specimen in the blood collection station during a review? Option A. Exact collection time recorded on the label or requisition according to policy. Option B. The phlebotomist's favorite tube brand. Option C. Only the patient's room number. Option D. A note saying collected sometime today. The correct answer is option A. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Tube brand does not communicate timing. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Question 40. Before collecting blood cultures, why is careful skin antisepsis critical in the outpatient clinic during a mock exam? Option A. It makes EDTA tubes clot faster. Option B. It reduces contamination that could cause a false positive culture. Option C. It eliminates the need for sterile bottles. Option D. It changes venous blood into arterial blood. The correct answer is option B. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. EDTA clotting is unrelated to culture site preparation. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. Question 41. When collecting blood cultures with other tubes, which priority is most important in the hospital unit during morning rounds during a skills check? Option A. Collect cultures after gray tubes. Option B. Touch the bottle tops after cleaning to confirm dryness. Option C. Maintain sterility and collect cultures before non-sterile tubes. Option D. Use a non-sterile transfer cup. The correct answer is option C. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Collecting cultures after other tubes increases contamination risk. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Question 42. If using a winged set for blood cultures, why is bottle order guided by facility policy in the urgent care laboratory during a practice drill? Option A. The order determines the patient's identity. Option B. The order prevents the need to clean the site. Option C. The order makes the needle reusable. Option D. Air in the tubing can affect which bottle should be filled first. The correct answer is option D. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Bottle order does not verify patient identity. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Question 43. For illegal blood alcohol collection, which requirement is especially important in the pediatric clinic during a scenario? Option A. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Option B. Use alcohol swabs for every blood alcohol specimen. Option C. Leave the specimen unlabeled until court. Option D. Let the patient carry the open tube to the lab. The correct answer is option A. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Question 44. When preparing for collection, which action best supports chain of custody for a drug screen specimen in the long-term care unit during a competency review? Option A. Use only verbal handoff with no signatures. Option B. Document each person who handles the specimen from collection to transfer. Option C. Store the specimen in an unlocked public area. Option D. Discard the seal after collection. The correct answer is option B. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Verbal handoff alone does not create a traceable legal record. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Question 45. Why are tamper-evident seals used on forensic or workplace testing specimens in the mobile collection site during a final review? Option A. They replace patient consent. Option B. They make refrigeration unnecessary for all tests. Option C. They help show whether the specimen was opened or altered after collection. Option D. They prevent the need for a requisition. The correct answer is option C. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. A seal does not replace required consent or authorization. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. Question 46. For an infant heel stick, which area is safest for puncture while preparing a CBC specimen in the emergency department bay? Option A. Posterior curvature of the heel. Option B. Center of the arch. Option C. Tip of the great toe. Option D. Medial or lateral plantar surface of the heel. The correct answer is option D. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The posterior curvature increases risk of bone injury. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. Question 47. Why should an infant heel puncture not be too deep while preparing a patient/INR specimen in the physician office lab? Option A. Excessive depth can injure bone or deeper tissue. Option B. A deeper puncture always prevents hemolysis. Option C. Depth determines the tube color. Option D. A deep puncture replaces the need for warming. The correct answer is option A. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Deeper puncture can increase injury and does not guarantee specimen quality. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Question 48. In the community health screening event, which finger is generally preferred for adult capillary puncture? Option A. Thumb pad for every test. Option B. Middle or ring finger on the palmar surface near the side of the fingertip. Option C. Index fingertip in all adults. Option D. Little finger near the bone. The correct answer is option B. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The thumb may be more calloused and is not the routine first choice. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. Question 49. After a finger puncture, why is the first drop of blood commonly wiped away while preparing a blood culture specimen in the preoperative testing area? Option A. It contains only white blood cells. Option B. It proves the patient is fasting. Option C. It may contain tissue fluid or contaminants that can affect the specimen. Option D. It activates the tube vacuum. The correct answer is option C. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. The first drop is not composed only of white blood cells. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. Question 50. How can warming a capillary puncture site help collection while preparing a fasting glucose specimen in the Oncology Infusion Center? Option A. It sterilizes the skin completely. Option B. It removes the need to identify the patient. Option C. It makes every specimen suitable for culture. Option D. It increases local blood flow when used safely. The correct answer is option D. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Warming does not sterilize skin. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Question 51. Why should excessive squeezing or milking be avoided during capillary collection while preparing a type and screen specimen in the dialysis-adjacent clinic? Option A. It can dilute the specimen with tissue fluid and cause hemolysis. Option B. It improves all glucose results. Option C. It makes EDTA unnecessary. Option D. It prevents clotting in serum tubes. The correct answer is option A. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. Glucose results can be affected by poor specimen quality rather than improved. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Question 52. When is dermal puncture commonly preferred over venipuncture while preparing a lipid panel specimen in the student skills lab? Option A. For every blood culture set. Option B. For some infants, small volume tests, or patients with difficult veins when appropriate. Option C. For all coagulation studies regardless of policy. Option D. Whenever patient identification is incomplete. The correct answer is option B. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Blood cultures usually require sterile venipuncture collection and adequate volume. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Question 53. A child begins to pull away during a draw. Which action supports safety in the occupational health clinic during a scenario? Option A. Continue while the arm is moving. Option B. Scold the child until they stop. Option C. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Option D. Ask another child to hold the arm. The correct answer is option C. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Continuing while the arm moves increases injury risk. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Question 54. Before proceeding with the draw, which explanation is best for a young child before a finger stick in the blood collection station during a competency review? Option A. Tell the child nothing will happen. Option B. Use detailed adult medical terminology. Option C. Promise a toy only if they do not cry. Option D. Use simple honest words such as a quick pinch and explain what they can do to help. The correct answer is option D. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Saying nothing will happen is misleading. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Question 55. For an older adult with fragile veins, which technique is most appropriate in the outpatient clinic during a final review? Option A. Use gentle anchoring and consider a smaller needle or controlled collection device. Option B. Slap the site hard to make veins appear. Option C. Use the largest needle available. Option D. Leave the tourniquet on for several minutes. The correct answer is option A. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. Slapping can injure delicate skin and is unprofessional. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Question 56. Why should adhesive bandages be used carefully on some older adults in the hospital unit during morning rounds during a study session? Option A. Adhesive changes the blood type. Option B. Fragile skin can tear when adhesive is removed. Option C. Older adults never need pressure after draws. Option D. Bandages prevent all anticoagulant bleeding. The correct answer is option B. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Adhesive has no effect on blood type. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Question 57. Before assembling equipment for a therapeutic drug level draw, which item should be checked in the urgent care laboratory during a structured exam prep drill? Option A. Only the color of the chair. Option B. The patient's favorite beverage. Option C. Tube type, expiration date, needle safety device, and requisition requirements. Option D. The brand of wall clock in the room. The correct answer is option C. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Chair color has no role in specimen acceptability. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Question 58. To protect patient safety, which sequence is safest after blood has entered the final tube in the pediatric clinic during a clinical simulation? Option A. Withdraw needle with tourniquet tight and no gauze ready. Option B. Activate safety device before removing the needle from the arm. Option C. Remove the needle and recap it before pressure. Option D. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The correct answer is option D. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Withdrawing with the tourniquet tight can increase bleeding and bruising. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharp's injury risk. Question 59. After reviewing the order, which action should occur before leaving the patient after venipuncture in the long-term care unit during a review? Option A. Confirm bleeding has stopped and provide appropriate post-draw instructions. Option B. Leave while blood is still oozing. Option C. Tell the patient to remove the bandage immediately. Option D. Dispose of sharps after walking to another room. The correct answer is option A. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Leaving active bleeding unattended is unsafe. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area. Question 60. Why is patient positioning important before venipuncture in the mobile collection site during a mock exam? Option A. It makes labeling unnecessary. Option B. It reduces the risk of falls or injury if the patient becomes dizzy. Option C. It changes EDTA into citrate. Option D. It allows the needle to be reused safely. The correct answer is option B. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Proper positioning does not replace specimen labeling. Body position does not change tube additives. Needles are single-use and cannot be reused. Question 61. In a routine phlebotomy scenario, which patient instruction is appropriate after a routine venipuncture in the emergency department bay during a skills check? Option A. Scratch the site if it feels itchy. Option B. Remove the bandage while still bleeding. Option C. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Option D. Bend the elbow tightly for 10 minutes. The correct answer is option C. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Scratching can disrupt the site and introduce contamination. Removing a bandage during bleeding can restart or worsen bleeding. Bending the elbow tightly can increase bruising. Question 62. Before proceeding with the draw, which laboratory department commonly performs CBC testing in the physician office lab during a practice drill? Option A. Microbiology only. Option B. Blood bank only. Option C. Histology only. Option D. Hematology. The correct answer is option D. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Microbiology focuses on organisms and cultures. Blood bank focuses on compatibility and transfusion-related testing. Histology focuses on tissue specimens rather than routine CBC testing. Question 63. During a scenario, which department usually performs patient and APTT coagulation testing in the community health screening event during a scenario? Option A. Coagulation or hematology coagulation section. Option B. Urinalysis only. Option C. Microbiology culture bench only. Option D. Cytology screening only. The correct answer is option A. Coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Urinalysis focuses on urine specimens. Microbiology culture benches identify organisms rather than routine clotting times. Cytology examines cells for diagnostic changes, not standard coagulation studies. Question 64. In the preoperative testing area, which department is most associated with blood cultures? Option A. Blood bank compatibility only. Option B. Microbiology. Option C. Histology tissue processing. Option D. Chemistry electrolyte analysis only. The correct answer is option B. Microbiology. Microbiology processes cultures to detect and identify microorganisms. Blood bank testing focuses on transfusion compatibility. Histology processes tissue rather than blood culture bottles. Chemistry analyzes chemical constituents and is not the main culture department. Question 65. For a fasting glucose collection, which department commonly performs type and screen testing? Option A. Microbiology only. Option B. Chemistry only. Option C. Blood bank or transfusion services. Option D. Parasitology stool testing only. The correct answer is option C. Blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Microbiology focuses on infectious organisms. Chemistry focuses on analytes such as glucose and electrolytes. Parasitology stool testing does not perform transfusion compatibility testing. Question 66. To protect patient safety, which department commonly analyzes electrolytes such as sodium and potassium in the dialysis adjacent clinic during a study session? Option A, histology. Option B, blood bank compatibility bench. Option C, cytogenetics only. Option D, chemistry. The correct answer is option D, chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Histology focuses on tissues. Blood bank compatibility testing is not the routine electrolyte section. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Question 67. After reviewing the order, which practice is part of phlebotomy quality assurance in the student skills lab during a structured exam prep drill? Option A, tracking specimen errors and using corrective action to prevent recurrence. Option B, ignoring mislabeled specimens if the patient is well known. Option C, changing tube labels after results are reported. Option D, skipping competency checks for experienced staff. The correct answer is option A, tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Familiarity with a patient does not make a mislabeled specimen acceptable. Changing labels after reporting hides errors and compromises traceability. Competency checks help maintain consistent safe practice for all staff. Question 68. Why are competency assessments important for phlebotomists in the occupational health clinic during a clinical simulation? Option A. They replace all written procedures. Option B. They verify that staff can perform required skills safely and consistently. Option C. They allow staff to ignore order of draw. Option D. They are only for patients who complain. The correct answer is option B. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Written procedures are still needed as standards for practice. Order of draw remains important regardless of competency status. Competency is a proactive quality process, not only a reaction to complaints. Question 69. In a routine phlebotomy scenario, which error should be reported through the facility's quality process in the blood collection station during a review? Option A. A patient correctly states their date of birth. Option B. A tube is mixed according to instructions. Option C. A specimen collected in the wrong tube type. Option D. A needle safety device is activated after use. The correct answer is option C. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Correct identity confirmation is expected practice, not an error. Proper tube mixing supports quality. Activating a safety device after use is the intended safety behavior. Question 70. Before proceeding with the draw, which activity is commonly associated with CLIA waived point of care testing in the outpatient clinic during a mock exam? Option A, changing the test procedure to save time. Option B, reporting results without controls when controls are required. Option C, using expired test strips because they look normal. Option D, following manufacturer instructions and documenting quality control for a simple approved test. The correct answer is option D, following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Modifying the procedure can invalidate the test category and results. Skipping required controls undermines result reliability. Expired strips may produce inaccurate results even if they look acceptable. Question 71. Before performing a fingerstick glucose test, which step supports accurate point-of-care results in the hospital unit during morning rounds during a skills check? Option A. Confirm test strip expiration and run required quality control according to policy. Option B. Use a strip from an unlabeled loose container. Option C. Skip patient identification because the device stores results. Option D. Apply disinfectant and test before the site dries. The correct answer is option A. Confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Loose unlabeled strips may be expired or contaminated. Device storage does not replace identifying the patient. Testing before the site dries can contaminate or dilute the sample. Question 72. Why must abnormal point-of-care results be handled according to facility policy in the urgent care laboratory during a practice drill? Option A. Abnormal results should always be erased. Option B. Critical or unexpected results may require confirmation, documentation, or immediate notification. Option C. Only normal results belong in the medical record. Option D. The patient should interpret the result without staff involvement. The correct answer is option B. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Erasing abnormal results hides clinically important information. Both normal and abnormal results may require documentation. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Question 73. For a bilirubin collection, which blood component is primarily responsible for carrying oxygen? Option A. Sodium citrate in plasma. Option B. Platelet granules only. Option C. Hemoglobin inside red blood cells. Option D. Tube separation gel. The correct answer is option C. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Sodium citrate is a tube additive, not an oxygen carrier. Platelets help hemostasis but do not primarily transport oxygen. Separation gel is part of a tube system, not a blood component. Question 74. To protect patient safety, which blood component is most directly involved in forming the initial platelet plug in the long-term care unit during a competency review? Option A. Albumin only. Option B. Glucose molecules. Option C. Chloride ions. Option D. Platelets. The correct answer is option D. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Glucose is an energy source, not a clotting cell fragment. Chloride is an electrolyte and does not form platelet plugs. Question 75. After reviewing the order, which vessel type is normally used for routine venipuncture in the mobile collection site during a final review? Option A. Vein. Option B. Artery. Option C. Lymphatic duct. Option D. Tendon sheath. The correct answer is option A. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. Arterial puncture is a different procedure and not routine venipuncture. Lymphatic ducts do not provide venous blood specimens. A tendon sheath is not a blood vessel and must be avoided. Question 76. Why is the basilic vein approached with extra caution in the emergency department bay during a study session? Option A. It contains no venous blood. Option B. It lies near nerves and arteries in the antecubital area. Option C. It always has a built-in tourniquet. Option D. It cannot be palpated in any patient. The correct answer is option B. It lies near nerves and arteries in the antecubital area. The basilic area has nearby structures that increase the consequence of poor needle placement. The basilic vein does contain venous blood. No vein has a built-in tourniquet. The vein may be palpable, but caution is still needed because of anatomy. Question 77. In a routine phlebotomy scenario, which term describes stopping bleeding after vessel injury in the physician office lab during a structured exam prep drill? Option A, hemolysis. Option B, glycolysis. Option C, hemostasis. Option D, hemoconcentration. The correct answer is option C, hemostasis. Hemostasis is the process that stops bleeding through vascular response, platelets, and coagulation. Hemolysis is red cell rupture. Glycolysis is glucose metabolism by cells. Hemoconcentration is increased concentration of blood components from fluid shifts. Question 78. A clotted lavender tube is received for CBC testing. Why is recollection usually needed in the community health screening event during a clinical simulation? Option A, clotting proves the patient was fasting. Option B, clots improve automated CBC accuracy. Option C, lavender tubes are supposed to clot before testing. Option D, clots trap cells and make cell counts unreliable. The correct answer is option D. Clots trap cells and make cell counts unreliable. CBC testing requires a well-mixed anticoagulated specimen so cells remain evenly suspended. Fasting status is unrelated to clot formation in an EDTA tube. Clots can block analyzers or distort cell counts. Lavender tubes contain EDTA and should not clot when properly mixed and filled. Question 79. An underfilled light blue tube arrives for patient testing. What is the main concern in the preoperative testing area during a review? Option A, excess citrate relative to blood may alter coagulation results. Option B, the specimen will become a blood culture. Option C, the tube will automatically refill in the lab. Option D, the patient's identity becomes verified. The correct answer is option A. Excess citrate relative to blood may alter coagulation results. Underfilling changes the anticoagulant to blood ratio and can make coagulation results inaccurate. A citrate tube cannot become a blood culture bottle. Tubes do not refill after collection. Fill volume has no role in verifying identity. Question 80. In the Oncology Infusion Center, which additive can falsely increase potassium if carried into a chemistry tube? Option A, clot activator gel only. Option B, potassium EDTA. Option C, sodium fluoride without potassium. Option D, sterile culture broth only. The correct answer is option B, potassium EDTA. Potassium EDTA carryover can contaminate chemistry specimens and falsely elevate potassium while lowering calcium. Gel itself does not add potassium in the same way EDTA contamination does. Sodium fluoride is associated with glucose preservation, not potassium EDTA effects. Culture broth is used for organism recovery and is not the classic potassium carryover problem. Question 81. For a type and screen collection, which tube should generally be collected before a lavender EDTA tube in venipuncture order? Option A, gray fluoride tube after lavender only. Option B, another lavender tube for every test. Option C, green heparin tube. Option D, no tube because EDTA always comes first. The correct answer is option C, green heparin tube. In the standard sequence, heparin tubes are collected before EDTA tubes to limit additive carryover effects. Gray tubes generally follow EDTA, not precede it as the key before lavender tube. Collecting another lavender tube does not answer the order requirement. EDTA does not always come first and can interfere with later tests. Question 82. To protect patient safety, which instruction is commonly given for a fasting blood test unless policy says otherwise in the student skills lab during a practice drill? Option A, drink sugary beverages before arrival. Option B, chew gum with sugar during the fast. Option C, eat a small snack because it will not matter. Option D, avoid food and most beverages except water for the required fasting period. The correct answer is option D, Avoid food and most beverages except water for the required fasting period. Fasting helps standardize results for tests affected by recent food intake. Sugary beverages can alter glucose and other chemistry results. Sugared gum can break the fast for some testing instructions. A snack can invalidate fasting status for tests that require it. Question 83. If a timed specimen is collected late, which action is most appropriate in the occupational health clinic during a scenario? Option A. Document the actual collection time and notify the appropriate person according to policy. Option B. Write the scheduled time on the label anyway. Option C. Discard the requisition without telling anyone. Option D. Change the patient's medication schedule independently. The correct answer is option A. Document the actual collection time and notify the appropriate person according to policy. Actual collection time is necessary to interpret timed results and decide whether recollection is needed. Writing the scheduled time is inaccurate documentation. Discarding the order without communication disrupts care. Medication timing decisions are outside routine phlebotomy authority. Question 84. When preparing for collection, which action increases the chance of blood culture contamination in the blood collection station during a competency review? Option A. Allowing antiseptic to dry. Option B. Repulpating the cleansed site with an unclean glove before needle insertion. Option C. Using sterile culture bottles. Option D. Collecting cultures before other tubes. The correct answer is option B. Repulpating the cleansed site with an unclean glove before needle insertion. Touching the disinfected site with an unclean glove can reintroduce skin organisms. Allowing antiseptic to dry supports effective skin preparation. Sterile bottles help maintain specimen integrity. Collecting cultures first helps reduce contamination from other tubes. Question 85. In a routine phlebotomy scenario, which behavior is outside appropriate phlebotomy scope in a routine collection setting in the outpatient clinic during a final review? Option A. Verifying patient identity. Option B. Labeling the specimen at the bedside. Option C. Interpreting the diagnosis and changing the provider's order independently. Option D. Reporting a specimen problem to the supervisor. The correct answer is option C. Interpreting the diagnosis and changing the provider's order independently. Phlebotomists collect and handle specimens but do not independently diagnose or alter provider orders. Identity verification is a core phlebotomy responsibility. Bedside labeling is expected practice. Reporting problems supports patient safety and quality assurance. Question 86. A patient asks when results will be ready. Which response is most appropriate in the hospital unit during morning rounds during a study session? Option A. Guess a diagnosis from the tube color. Option B. Promise exact results in 5 minutes for every test. Option C. Tell the patient results are not their concern. Option D. Explain that the laboratory or provider will report results according to facility process. The correct answer is option D. Explain that the laboratory or provider will report results according to facility process. The phlebotomist can provide general process information without interpreting or promising results outside their role. Tube color does not allow diagnosis. Turnaround time varies by test and setting, so a universal promise is unsafe. Dismissive language is unprofessional and does not support patient-centered care. Question 87. During a structured exam prep drill, which disposal choice is correct for blood-soaked gauze after a draw in the urgent care laboratory during a structured exam prep drill? Option A. Place it in the appropriate biohazard waste container according to policy. Option B. Place it in the sharps container. Option C. Put it in a clean supply drawer. Option D. Hand it to the next patient to hold. The correct answer is option A. Place it in the appropriate biohazard waste container according to policy. Blood-contaminated soft waste belongs in the designated biohazard stream when required by policy. Sharps containers are reserved for needles and other sharps, not soft gauze. A supply drawer must remain clean and uncontaminated. Giving contaminated gauze to another patient creates exposure risk. Question 88. In the pediatric clinic, which item should never be stored with clean blood collection supplies? Option A. Unopened sterile needles. Option B. Used needles or blood-contaminated materials. Option C. Unexpired evacuated tubes. Option D. Clean tourniquets ready for use. The correct answer is option B. Used needles or blood-contaminated materials. Clean supplies must be protected from contamination to prevent patient exposure and specimen problems. Unopened sterile needles are appropriate clean supplies when stored correctly. Unexpired tubes belong with clean collection inventory. Clean tourniquets can be stored for patient use if facility policy permits. Question 89. Why should a phlebotomist follow the facility procedure manual rather than personal shortcuts in the long-term care unit during a review? Option A. Shortcuts are always faster and safer. Option B. Procedure manuals are only for new employees. Option C. Standard procedures support consistent safety, quality, and regulatory compliance. Option D. Regulations do not apply to outpatient settings. The correct answer is option C. Standard procedures support consistent safety, quality, and regulatory compliance. Written procedures create a consistent standard that reduces variation and errors. Shortcuts can bypass safety checks and increase risk. Experienced staff are also expected to follow current procedures. Regulatory and safety expectations apply across collection settings. Question 90. To protect patient safety, which action helps prevent leakage during specimen transport in the mobile collection site during a mock exam? Option A. Loosen the stopper to release pressure. Option B. Carry open tubes by hand. Option C. Place tubes loose in a coat pocket. Option D. Ensure the tube is closed securely and placed in approved transport packaging. The correct answer is option D. Ensure the tube is closed securely and placed in approved transport packaging. Secure closure and proper packaging protects staff, couriers, and specimen integrity. Loosening the stopper can cause leaks and exposure. Open tubes increase spill and contamination risk. A coat pocket is not approved specimen transport packaging. Question 91. A serum tube and lavender tube are ordered after blood cultures and citrate, which should be collected first in the emergency department bay during a skills check. Option A. Serum tube before lavender tube. Option B. Lavender before serum. Option C. Gray before both in every case. Option D. Order does not matter if both are mixed. The correct answer is option A. Serum tube before lavender tube. Serum tubes are collected before EDDA tubes to reduce EDDA carryover into chemistry specimens. Lavender first can contaminate the serum tube with EDDA. Gray tubes are generally later in the order and are not automatically before serum. Mixing tubes does not correct additive carryover. Question 92. When preparing for collection, which tube is most associated with ESR testing in many phlebotomy settings in the physician office lab during a practice drill? Option A. Blood culture bottle only. Option B. Lavender EDDA tube or designated black citrate tube depending on method. Option C. Gray fluoride tube for every ESR. Option D. SST for all ESR methods. The correct answer is option B. Lavender EDDA tube or designated black citrate tube depending on method. ESR collection depends on the facility method, commonly EDDA, or a designated citrate ESR tube. Blood culture bottles are for microbiology cultures. Gray fluoride tubes are not the usual universal ESR container. SST serum is not appropriate for all ESR methods because ESR evaluates cellular settling. Question 93. Why should serum tubes be allowed to clot before centrifugation unless policy states otherwise in the community health screening event during a scenario? Option A. Clotting makes EDDA work faster. Option B. Early centrifugation improves blood culture growth. Option C. Centrifuging too early can leave fibrin strands and compromise serum quality. Option D. Serum tubes contain no blood cells. The correct answer is option C. Centrifuging too early can leave fibrin strands and compromise serum quality. Serum specimens need adequate clot formation so serum separates cleanly after centrifugation. EDTA is not the additive in a serum tube. Blood culture growth is unrelated to serum tube clotting. Serum tubes initially contain whole blood cells before clotting and separation. Question 94. Before proceeding with the draw, which tube should not be centrifuged before it has clotted when serum is required in the preoperative testing area during a competency review? Option A. Lavender EDTA tube for CBC. Option B. Light blue citrate tube for patient. Option C. Gray fluoride tube for glucose. Option D. Red top or serum separator tube. The correct answer is option D. Red top or serum separator tube. Serum tubes must clot before centrifugation to obtain clear serum and avoid fibrin problems. Lavender CBC specimens are whole blood and are not clotted for serum. Light blue specimens are anticoagulated plasma for coagulation testing. Gray specimens contain additives for glucose preservation and are not serum clot tubes. Question 95. During a final review, which action is appropriate if a patient has a latex allergy in the Oncology Infusion Center during a final review? Option A. Use latex-free equipment and follow facility allergy precautions. Option B. Use latex equipment briefly because exposure is short. Option C. Ignore the allergy if gloves are powder-free. Option D. Ask the patient to hold the latex tourniquet away from the skin. The correct answer is option A. Use latex-free equipment and follow facility allergy precautions. Latex-sensitive patients require latex-free supplies to prevent allergic reactions. Short exposure can still trigger a reaction. Powder-free latex may still contain latex proteins. Having the patient hold latex does not remove exposure risk. Question 96. In the dialysis-adjacent clinic, which mismatch requires resolution before drawing blood? Option A. The patient is wearing a sweater. Option B. The requisition name does not match the patient's wristband. Option C. The collection tray has extra gauze. Option D. The phlebotomist has 2 tube holders. The correct answer is option B. The requisition name does not match the patient's wristband. An identity mismatch can lead to a wrong patient specimen and must be corrected before collection. Clothing choice does not create an identification conflict. Extra gauze does not affect patient identity. Having additional clean equipment does not create a patient mismatch. Question 97. During downtime when barcode labels are unavailable, what should guide specimen labeling in the student skills lab during a structured exam prep drill? Option A. No labels until the computer returns. Option B. Labels borrowed from another patient. Option C. Approved manual identification and labeling procedure. Option D. Memory of the patient after the shift. The correct answer is option C. Approved manual identification and labeling procedure. Downtime procedures are designed to maintain traceability when electronic systems are unavailable. Unlabeled specimens are unsafe and may be rejected. Borrowed labels cause wrong patient errors. Memory after the shift is not a reliable labeling method. Question 98. Why should reusable tourniquets be cleaned or replaced according to policy in the occupational health clinic during a clinical simulation? Option A. They change venous blood into serum. Option B. They make citrate tubes under fill. Option C. They replace the need for gloves. Option D. They can become contaminated between patients. The correct answer is option D. They can become contaminated between patients. Tourniquets contact patient skin and the environment, so cleaning or single patient use prevents cross-contamination. A tourniquet does not determine whether blood becomes serum. Citrate tube fill depends on collection volume and vacuum, not tourniquet cleaning. Gloves are still needed when blood exposure is possible. Question 99. After reviewing the order, which action helps keep a cleaned venipuncture site uncontaminated? Option A. Do not touch the site again unless repulpating with a sterile or policy-approved method. Option B. Fan the site with the requisition. Option C. Place the used alcohol pad back on the site. Option D. Scratch the site to improve blood flow. The correct answer is option A. Do not touch the site again unless repulpating with a sterile or policy-approved method. Avoiding recontamination preserves the effect of skin antisepsis before puncture. Fanning with paperwork can introduce contaminants. A used alcohol pad is contaminated after use. Scratching damages skin and contaminates the puncture area. Question 100. When preparing for collection, which situation requires immediate cleanup or removal from the draw area? Option A. A sealed sterile needle in its package. Option B. A contaminated needle holder or blood on the work surface. Option C. A printed order in the correct patient's chart. Option D. A clean unopened gauze packet. The correct answer is option B. A contaminated needle holder or blood on the work surface. Contaminated surfaces and equipment can expose staff and patients to blood-borne pathogens. A sealed sterile needle package is clean until opened. A correctly placed order does not create a contamination hazard. Clean unopened gauze is appropriate collection supply.